So today I want to talk about office-based liposuction versus the way that I like to do it, which is liposuction in a hospital or an accredited facility, outpatient surgery center. We get questions all the time, patients saying, well, can't we just do a little bit of liposuction in the office? One of the things about Ohio, which is, I think, a very good thing from a patient safety standpoint, is there are a lot of rules in Ohio about being able to perform liposuction in the office. Mostly set up to create patient safety, because I think that is the most important thing we talk about when you're having liposuction or any surgical procedure. But you see a lot of places that will offer in-office liposuction, and there's a lot of criteria that they have to meet. The first one is who's doing the procedure. In general, the first option to be able to do in-office liposuction is you have to have hospital privileges to be able to perform that procedure. That's probably the baseline. If a hospital isn't going to give you privileges to perform liposuction in the office, I don't know that you necessarily should be, or should be going to that provider if that's the only place they can do it. There are some other ways around it. If you're board certified in the specialty in which liposuction is generally considered to be part of, like plastic surgery or dermatology, if you've done residency training in those, or if you've taken a didactic course with hands-on experience, that can be a way to learn how to do liposuction, and that's fine as far as the Ohio rules, but you got to make sure your provider has that. I satisfy all those criteria, but I still don't want to do liposuction in the office because I think that if we're talking about what's the downside of being in the hospital or a surgery center is you have to pay a little bit more in terms of fees or pay for an anesthesiologist. I think paying for your safety and ensuring your safety as best we can is worth it. And I don't want to cut corners or have you cut corners on the cost of surgery and put yourself at risk. There's a couple other pieces in terms of office liposuction versus hospital or surgery center liposuction. We talked about there's limits on the size of the cannula that you can use, the size of the liposuction instrument. In general, in the office, it's got to be less than a 4.5 millimeter cannula. And one of my favorite cannulas, especially if we're talking about larger volume liposuction, is to use a 5 millimeter cannula, which you can't technically in Ohio do in the office. Also limits in how much you're allowed to take off in the office, generally limited to 4.5 liters. Once you get past 4 liters, we worry about your fluid shifts and fluid balances, and doing that in a hospital where we can replace the fluid better and more scientifically, and have an anesthesiologist who's only focused on that and not focused on your procedure is, again, aids to patient safety. So for those reasons, I do take my patients to the operating room in order to do liposuction. I think it's better for your safety, it's better for the outcomes we get. It may cost a little bit more, but you are worth it, and don't skimp when it comes to cost of surgery to sacrifice safety.